This is Dr. Samin Afzal from Hyderabad, Sindh, Pakistan. Today we will discuss phacoemulsification by Equatorial chalk technique. This is a patient with grade 2 nuclear sclerotic cataract. Needle cystotome is passed through surgical limbus. Approximately 2 millimeters behind the anatomical corneal limbus. Anti-clockwise round curvilinear capsular axis is formed about 5 to 5.5 millimeters in diameter. We should always try to avoid small rhexis because it can give rise to many surgical problems. Whenever we start doing intraocular surgery, we should have our approach through surgical limbus of the cornea. We can avoid many complications related to the cornea. The main incision is created through surgical limbus by means of a diamond phaco knife of 2.75 millimeters wide. By two-step incision, viscoelastic solution is injected into the anterior chamber to deepen the anterior chamber and to facilitate the formation of side pores at 3 o'clock position and 8 o'clock position in the opposite directions. Side pores are very important and quite beneficial to the patient regarding the maintenance of temperature inside in the anterior chamber during the process of phacoemulsification and when the phaco power is emitted, and also to negate the astigmatism against the rule. And side pores are also important, quite beneficial, removing the trapped cortical material at 6 o'clock and 12 o'clock positions. And now iododissection is being performed at all directions beneath the anterior capsular rim. Nucleus is grade 2. In this setup, phaco power is adjusted to 60, vacuum 500 and fluoride 40. Bleeding at the side ports is very good sign of postoperative rapid wound healing. Phacoemulsification is started by forming a small trench with the phaco-tip bevel up exactly in the middle of the nucleus. And then through side chopper the nucleus is pushed down, and at 6 o'clock position the nucleus is a little bit raised and equator is caught by phaco tip, and with the help of a phaco chopper the nucleus is broken into small fragments. This is very easy and very approachable and acceptable technique by holding the nucleus at equator and chopping it, breaking the small fragments. And again we can see the nucleus is broken by means of a phaco chopper at the equator, and the fragments are removed from anterior chamber. Hardly not more than 2 minutes time. Minimum phaco is applied and maximum vacuum is utilized just to save the corneal endothelium.